Hey everybody, it's Jessica DeMassa with What's the Future Health. We are talking to the who's who of health tech and healthcare innovation. And today we are visiting with an old friend. Please meet Dr. Julia Hoffman. She is the head of mental health strategy at Teladoc Health. And some of you might remember her like I do from Livongo. So Julia, it's good to have you here.
Thanks so much for having me. Fun to see you again. Hope
It
you've been having
is.
a
The
joyous
last time
COVID.
we spoke was a year ago, almost to the day, and we were talking about the rollout of MyStrength at Kaiser. And now we're talking about the rollout of MyStrength Complete to like the entire nation here, maybe even globe. I'm not quite sure.
Well, yeah.
But we were talking about that. And so I want to dive in there and actually kind of pick your brain about what's been going on with the MyStrength mental health offering since the last time I spoke with you, when it was almost, it seemed like just it was a CBT kind of app, like, and I'm sure that now, backed by Teladoc Health, you've got a lot more that you've been able to build into it. So tell us what you've been architecting over there.
That's right. It's been an incredible year of building, even without having any direct contact with our colleagues and friends as we've grown the team and grown the product. So we started at Livongo by acquiring MyStrength. MyStrength was an existing product that had been around for almost a decade at that point and really had been the market leader in terms of breadth and scale in mental health. So digital mental health started as self-serve apps where we just needed to prove out the point. People can use these tools and improve from them. There's tons of data that shows that now, hundreds literally of randomized control trials that show that people can use apps, websites, et cetera, independently to get some sort of clinical benefit. The question is, how do we move from the infancy of that field to a more sort of adolescent or adult kind of perspective on how to address the real mental health needs of the whole nation, of the whole world? As you said, yes, in fact, we are a global operation. And so what we have done is really taken a step back. You know that I'm a licensed clinical psychologist. I actually practiced for a long time. I worked in huge integrated healthcare systems like the Department of Veterans Affairs, and bring my own really deep understanding of what works and what doesn't in the digital tools as well as in traditional models of care. So MyStrength Complete is an absolute direct response to what is not working in mental health care in this country. Now, we were incredibly, I don't know if it was foresight on our part or what, but I will say that I feel lucky on behalf of myself and on behalf of the country that when the pandemic hit, we were ready for it. So a year ago, we were talking about MyStrength with Kaiser. We had the concept of remote digital mental health tools. And now we've expanded that so that it's got all of the incredible capabilities of MyStrength that have been around and well tested in the world. It's got the clinical services of Teladoc so that we can leverage that massive provider network. And then it's got some bridging steps in between. So coaching, guides, crisis management, all of the stuff that's not necessarily with a licensed clinician, but is incredibly important in keeping people engaged, in meeting the needs of subclinical and milder populations. But also, almost as importantly, MyStrength Complete has the magic of Livongo sewn into it. So Livongo, we talked about a year ago, and many times you've talked about this with folks since. Livongo's AI engine that drove everything, right? The nudging, the personalized care. We give you exactly what you need, exactly when you need it, at whatever sort of scope you need it, whatever size of intervention. That's what's underneath all of MyStrength Complete. So it's not just the comprehensive step care solution. It's also the magic and intelligence of Livongo under the hood, so that we can take people in to this broad digital front door, say, we don't care if you know what's wrong. We don't care what's wrong. We don't care how bad it is. Get to the front door. That's all we're asking. And then we're going to take all of these tools, all this technology, and all of these clinical smarts that back it up and take your hand and just guide you through the experience wherever you need to go, whichever step of care you need out of those, however long you need that step of care, whichever program you need, et cetera. So it's really a comprehensive solution and takes that digital tool and then builds out with both Teladoc and Livongo's capabilities.
That's amazing. Those applied health signals, they're just still out there firing away, huh?
Still applying health signals over here.
I love it. That's great. Okay, so I want to go back to one of the things that you said when you're at the start of your answer about how you it wrapped up beautifully how you talked about taking the AI plus AI engine, the applied health signals of Livongo, and then adding to that, the robust virtual care offering that Teladoc Health offered, and kind of architecting together the solution that really covered like that whole ecosystem, had the data underneath it. One of the things you said in your answer early on was that you kind of thought about what wasn't working with digital mental health care and designed to solve that. So can you unpack just quickly, what was not working with digital mental health care up until this point?
Right. There is a world of point solutions out there. And I watch your videos regularly. I follow you on Twitter. I see, along with everybody else, the massive amount of investment that is still going in to digital mental health. It's an indication to me of the level of desperation. We understand that we don't have the right solutions yet, right? We understand that there's a desperate need and that supply and demand are not currently matched. So the issues with all of these point solutions, all of these sort of new entrants to the field, not all, many of the new entrants to the field, is that you have to start small. And unfortunately, starting small doesn't really work all that well with mental health, because unlike diabetes, unlike hypertension, where you have a specific diagnosis, you go to the doctor, they tell you what it is, they tell you what the interventions are and how you need to follow it over time and navigate that care over the course of your lifetime. Mental health is tricky. It's episodic. People more often have more than one condition going on at the same time that can overlap and impact each other. We understand that most people can't actually differentiate between, am I stressed right now because it's the middle of a pandemic and I have 2 small kids and I'm trying to do this job, but also homeschool and teach my kindergartner how to read? Or is it depression? Right. Or anxiety, right? Like, who could tell? Like, I mean, I can tell, but most people cannot tell.
Having a clinical background, most people.
Right. They don't just give the license.
If you're me, it vacillates by the minute, really. I mean, it's like every 15 minutes I'm depressed or anxious. It's one or the other.
Right. Well, you and everybody. So, so mental health needs are episodic, right? They're not necessarily chronic conditions. Some are chronic, many are not. So the apps and all of the products that have come out more recently are really assuming that the average consumer can come in and indicate, what is my diagnosis? People don't necessarily know if they have one at all or what it is, right? Is it social anxiety or is it generalized anxiety? Is it a specific phobia? Does anybody know the differences between these words? Again, like, I've got my DSM behind me. I could tell you, but most people have no idea, right? Yeah. And then also people are expected to craft their own treatment plan, which is especially ridiculous, right? I feel positive that it's not depression or anxiety, it's stress, and that what I need is mindfulness, not CBT. Or what I need is, this game for treating my anxiety. Whatever it is, the expectation that people can self-identify what they need, what's going on, build their own treatment plan, and then accurately identify when they may need more care than that, and how to navigate between those digital solutions, which are incredible, so valuable, working really, really well for a lot of groups of people. But how do you then navigate that barrier between digital and virtual or traditional models of care? Because for some people, in general or in certain moments, they need to be able to step up, right? Yeah. And they're going to need a psychiatrist to step in with meds. They're going to need a therapist to step in with, a more intensive evidence-based intervention. And so what we've been trying to create is that porous boundary between all of the services so that we can meet people exactly where they are, and not just in general, but in this specific moment. What you need in this specific moment is therapy with a Teladoc provider. Great. We will send you for that. And when you're done with that, come on back to the app, because we'll provide you all the mindfulness tools and in the moment coping strategies and whatever else you need.
I love this. And I think this goes back to, you guys also have done a consumer survey around digital mental health and virtual care being used in comparison to in-person care. And reading through that executive summary of this is one of the things that really stood out to me. Was it was like 60% of people have no idea what their diagnosis is, like 60%-ish. And then like further, that same, I don't know if it's the same 60%, but also is like around 65% have no idea where to start. And I was like, as you're talking about like, people, choosing certain types of point solutions or whatever, I feel like, part of this might be coming out of, desperation of just like, I've tried to deal with this myself. I can't meditate anymore. I can't journal anymore. I'm going to just try this. And like, just, going with, a referral from a friend or something they saw in an ad on Instagram or whatever it might be. And then further to that, the other thing I feel like that might be, making the opportunity right for something like this right now is that, also in that survey, talking about how people are not afraid to use their employer-sponsored health plan to utilize mental health services anymore. And that's awesome. And that was like a huge number, 80%, which means I think, we underestimate or overlook the fact that there was so much stigma before and that there isn't as much stigma right now. I'd love for you to speak to that point, because I know, you've been in this industry for a long time providing, figuring out a way to just make mental health services broadly available, improve awareness of them for the people who need them, make it, a safe and, okay experience for them to access them without feeling like they're being judged, without feeling like there's that stigma there. Do you think we lost the stigma is one of those things that was maybe eliminated as a result of the pandemic?
Oh, I wish. We have moved in that direction for sure. I think that you're exactly right, that stigma, or at least, recognition that mental health needs are everywhere and that it's not just you or just your family suffering with this in silence. I think that that is very real. And the pandemic has pushed that recognition forward, largely just because so many more people are suffering right now. In general, when I quote what percentage of the American adult public, have mental health, actual diagnosable mental health conditions, somewhere between 20 and 25%, depending on whose numbers you're using. During the pandemic, it looks like it's closer to 40,
Wow.
which is simultaneously surprising and also, anywhere below 100 is sort of surprising to me.
Kind of, right? Like
at this point. So it's so widespread. It has given us an opportunity to have a new conversation that I hope will stick with us. I hope that, once we're all past this current moment, and that's hopefully anomalous moment, that we'll hold on to that recognition and we won't have this be a point in time where it was okay for people to seek care. Or to acknowledge that they need help. That said, yes, we have seen an incredible reduction in stigma. People are seeking health care and mental health care in record numbers. So we see that in Teladoc utilization, which has gone up 500% for mental health care. We've seen it in MyStrength utilization as well. And now I'm sure we will see it going, forward a couple of years in the future. It's driven by a couple of things that I can sort of put my finger on. Number one, as the pandemic. Number two, millennials. So millennials, I just learned this week that I'm a geriatric millennial. So
what does that mean?
I'm coping with that. I don't know. This is the New York Times.
Millennial. Oh my God.
I know this is the New York Times trauma inflicted on me this week, not real trauma. So, millennials have had a rough go, and so they are considered a lot of things that are negative. The burnout, as in burnt out from working, the burnout generation. We're poorer than every generation before us. We are struggling with mental health at a scope that is previously unheard of. However, we're also the therapy generation. And so millennials, and certainly Generation Z behind millennials, are coming up with the expectation that mental health needs are fine, that mental health care is fine. And so that's a big driver, right? Is that as more and more of the workplace is made up of millennials, we see that increased utilization. But actually, that covers the fact that we have seen growth across actually every single age group and every gender, every, sort of industry. So it really is across the board. a big piece of it is that we are providing these stigma-free alternatives to care. When you talk to real mental health patients or people who are contemplating mental health, but they're reluctant consumers of care, they don't want to sit in the waiting room.
Yeah.
They don't want to show up to the mental health clinic, right? They don't want the therapist's voicemail on their phone.
Yeah.
It's sensitive, right? And so the fact that we have these digital options means that people can engage with what they need without necessarily going all in a way that's going to feel threatening to them. And then the magic of the comprehensive stepped care solution with this very, very broad digital front door is, okay, you don't want to say you're depressed, but you want to say that you've got insomnia. Everybody, I mean, I live in Silicon Valley. Everybody's gloriously tired all the time. It's like a badge of honor, right? We love being tired here. So, if you want to cop to insomnia, great. Come on in with your insomnia. We'll help you with that. And then eventually what we will do is we have our engine is saying, you know what, you're saying it's insomnia, but actually it's probably also depression. What do you think of taking a step into the depression program? What do you think about engaging with one of our therapists? Because maybe that would be helpful. So we are able to allow all comers and meet them wherever they're at in terms of their readiness to engage in mental health care. And at the same time, continuously be trying to nudge them towards what we think would be ultimately more helpful for them if they're willing. And if they're not, then they can stick with, relaxation exercises for as long as it takes or whatever they're
without getting too into the weeds on the tech side of that nudging, or like how you're able to discern, like, okay, your insomnia is insomnia, but it's also got this, this, and this. How does that work? Like, I mean, in a basic way, like, I mean, can you divulge any of the magic behind that?
Yeah, well, I can tell you a couple of things. I can tell you that it is all sort of the foundation is the AI engine from Livongo. And so we really wanted to build on our strengths there, right? We know how to nudge. We know how to identify a hot moment that's psychologist language, hot moment, but a moment where you can actually provide an intervention that's going to work. So all of that knowledge came from Legacy Livongo.
Okay.
On top of that, we have what we call macro personalization, which is essentially we do assessments at the front end of the experience and continuously throughout, both assessments where we're actually asking you questions and also where we're looking at your passive behavior and seeing you vote with your feet, right? Like if you say that you're depressed and you want help with depression, and then you come into our app and you make a beeline for the alcohol abuse section, gives us some information, right?
Right.
And it happens all the time because although people are willing to engage with employer-sponsored mental health care, they don't necessarily want to put it right in the headline, what's going on, right? And especially now where everybody's drinking more than they expected, using whatever drugs are legal in your state, the more than they expected, right? Just to push through the pandemic, we're seeing a lot of that. So the macro personalization engine sticks you into the right step and the right type of care and the right focus for your care to begin with. And then the micro personalization over time is the engine that's continuously saying like, hey, today, maybe this is what you should be looking at based on what we think is going on for you. Based on
I love it. It's so fascinating.
We're applying health signals, Jess.
Yeah, I love it. I love that. I mean, no, it's like, it's still so magical to me. It's really interesting. And I think like, does it pull in and this is like my legacy Livongo thinking more on like the diabetes management side or the hypertension side, but is it pulling in, are you guys pulling in biometric data as well?
Well, to some extent. With Livongo's whole person models, we really want to be able to help identify. So come all the way to the front end of that mental health process and understand that even problem identification is a tricky row to hoe, right? And so we actually have some incredible innovations that we've applied for all kinds of IP protections for. That we'll talk about more in the future when we can, how we can use our own glucometer to identify mental health needs. Ooh. So when you look at a person with depression, this is not, This is work. I don't know if you've met Anmol Madan, our chief data scientist. He had done a lot of this work in previous lives as well.
Mm-hmm.
There's a lot of evidence that when people are depressed, you can see it happening in ways that you may not expect. People travel less and less far from their house. That's called geodiameter. Their diurnal variations, so what they do in the course of their day and how they schedule their day kind of changes and falls apart a little bit. So we can see that with our blood glucose meter, right? Because people are tracking. We know when they're eating. We know when they're sleeping. So we can help people by nudging them and saying, hey, what about taking a trip over to MyStrength? How about that?
That's so
How about,
cool.
yeah, it's cool. It's
I really
cool. But
love that.
within MyStrength, no digital, no biometrics just yet.
Just yet. Okay. So I want to ask you this then, Julia, like, you know, as far as the clinical outcomes from virtual, I mean, you talk about something like that I understand is coming down the pipe, but it's like the potential for that is incredible. Where we're at now, where it's like where MyStrength Complete is today, you know, how does that measure up with like the types of clinical outcomes that you would see from in-person therapy or some of the other things that are out there? I mean, I know in your consumer study, it's like the consumers like the experience just about the same. Like, hey, it's the same in person as it is virtual. Great. But it's like from the clinician point of view, you know, when you're looking at this and when you're trying to gauge, is this effective? Is it more effective? You know, tell me what you're seeing.
Yeah. Well, so I'm going to separate the digital from the virtual. I think you're asking
Okay.
about virtual. Are you asking about virtual?
Yes.
Like as in provider-led care? Yeah. So there actually was a brand new study that came out that was not our study, but that showed that clinical outcomes from digital and or so virtual and in-person care are the same. For almost all conditions at almost all levels of severity. And so we know that people are fine with this mode of operating. Again, it's been pushed forward by the pandemic. Providers who are uncomfortable with it, patients and members who are uncomfortable with it have come along because we've all spent the past year on Zoom. So we get it now, right? Where they may not have before. People who were sort of trepidatious before and then got forced into it have seen that it's actually incredibly effective and beneficial. I said that I came from the Department of Veterans Affairs, largest integrated healthcare system in the country, and often focused on mental health needs. Really, DOD and VA were the very first ones to be doing mental health and have provided incredible guidelines that can be followed by anybody outside of those systems, including, you know, really specific details like if I'm doing therapy with you by video, I need to be able to have enough of a good enough connection to see the tears in your eyes. Not necessarily tears falling down, but tears in your eyes, right? That's the VA rule. So we have guidelines that we can use to ensure that the quality of care is high. We have an entire quality team to ensure not only that we are aligned with evidence-based practices, but also that we're getting the clinical outcomes and tracking the clinical outcomes to prove that actually in our context with our providers and our patients that we're getting good outcomes. So we know for a fact that we are. As a clinician, I will say 26% of the variance in outcomes in mental health care comes from the therapeutic alliance. Okay. So meaning I can teach you all the CBT skills in the world, but if I'm not credible to you as your therapist, if you don't like me, if you don't like me, if you don't connect with me, if you don't believe that I'm an expert, if we don't agree on your goals in therapy, these are all things that factor into our working alliance and that directly impact outcomes. And so capturing that in virtual form is incredibly important. We train our providers to ensure that they're making that meaningful connection because you have to have it. You can't do therapy. It's not like handing you a medication. It's not the same thing, right? Yeah. And so can you do that? Yes. Are there certain conditions like, you know, certain very florid psychotic conditions where mostly what you're seeing is a very flat kind of affect where it's hard? Yes, but it's also hard in person. And so for the majority of the population, this works great for everybody. And I don't actually have any concerns at all. Okay. In digital, what takes the place of that therapeutic alliance is the user interface and the user experience. because that's where you figure out, like, does this app seem credible to me? Does this app seem to have the right information? Is it tracking with my actual goals, et cetera? So it's a different thing.
Yeah, no, I completely see the differentiation when you put it that way. I want to ask a couple of last questions about MyStrength Complete rolling out in July, like we said. Right. Going through to consumers via their employer insurance or via health plans. Why not take it direct to consumer?
I think that right now, what we want to ensure is that we are meeting the majority of the public where they actually get their health care, right? And so for most people, that's either through their plan or through their employer. I think that direct to consumer does have some additional sort of challenges and opportunities there. And that I wouldn't rule out us ever going there. It's not currently on the roadmap. But I think that the cost of user acquisition, all of those places are places where we would need to put a lot of focus. And so far, we haven't.
How important do you think it is that, I mean, and I've talked to folks at Teladoc Health for a long time, and I know the importance of the whole virtual primary care piece of the offering. So I mean, how important do you think it is to have the mental health benefit aligned with that virtual primary care? Is that like the point of differentiation between you guys and like Ginger or you guys in Talkspace, is to have it connected to that virtual primary care offering?
Yeah. So 80 to 90% of mental health care in this country takes place in primary care. 80 to 90. It's crazy. And when I say mental health care, the standard of care is your primary care doc gives you a script and go home. That's it, right?
I was going to ask you that if it was routing or if it was like a navigation kind of like you should go see or referral, or if it was more that where it is like, let me just write you a prescription for Zoloft. You just let me know how you're doing in 3 months.
Right. Or we'll see, or I'll see you in a year and then I'll hear that you took it for 2 weeks, had the side effects, but none of the clinical effects and stopped taking it. Right. Yeah, so I think that most primary care docs are responsible and do attempt to provide referrals. However, if you've ever sought mental health care in this country, I mean, it is very, very hard to get hooked up with a provider that's going to be a fit for you, that's going to see you in a reasonable period of time, that's going to be able to meet you on your schedule. And so the referrals often don't pan out. However, the antidepressants, especially also anti-anxiety medications like benzodiazepines, they're huge. They're being handed out in primary care most frequently, much more than in psychiatric clinics, right? Where there are just fewer psychiatrists. So we know that that's where mental health care is actually happening. We also know that primary care docs aren't awesome at prescribing, let alone, making referrals, let alone identifying the right conditions. So most of the time, primary care docs are not actually doing a great job of identifying the right mental health diagnosis. It's complicated. We have a lot of them in the overlap.
Ask for in a 15-minute window when you got to do a whole bunch of other stuff, right?
Right, where you're actually looking at Epic at the same time, right? Or Cerner.
Yeah.
Right. Right. So we see this so again, this isn't rocket science. I didn't invent any of this. There has been an incredible amount of academic energy that's gone towards concepts like collaborative care models, co-located mental health and primary care. And they are incredibly effective at improving the quality of mental health care that people receive in primary care, but also in improving people's overall health. Because what we see is people with mental health needs actually have more primary care appointments. Their primary care appointments are more expensive. They have more of every kind of medical utilization. And so we can use mental health care as a way to address all of the other underlying issues as well. And so, yes, we are partnered really closely with the virtual primary care team in order to bring over as much of the mental health offerings as we can and as makes sense. So the digital offerings, making referrals to our virtual care, even using some of our sort of intelligence tools behind the scenes to help primary care docs do a better job just at baseline, even independent of additional mental health services.
I love how all of this is starting to integrate together. All right, last thing for you before we let you go. What's ahead for MyStrength? I mean, it's like, if I don't talk to you again for another year, what will you have done to MyStrength Complete? What's on that roadmap that you teased us about?
Yeah. Yeah. Well, I think we are so excited for the initial rollout. And I will say I have been at this digital mental health care, remote mental health care for a decade and a half. I can't think of anybody who's been at it longer than I have. This is officially my life's work.
Oh my God, you're geriatric digital virtual mental health as well.
Oh my goodness. Applying the term geriatric to myself is really, it's thrown me for
Well, I mean, you did it to yourself right there.
I know. So I think that even with all of that experience, we are a data-driven company, right? Like we are going to continue to evolve in the direction that makes sense based on the signals that are coming in. So we have folks who are using the system now. We're continuing to evolve it. We want to ensure that we can optimize every part of the experience of this product first to really meet the promise that we're putting out there of this is the digital front door. Please come to my door, ring my bell. I will take your hand and guide you through. And that is a really, really tall order. It took me, 6 years of graduate school and then a couple more years to get a license, et cetera, et cetera. I mean, it takes a while to get smart in these things. And so we're going to hold our, digital and virtual products to that as well. So step one, optimize what we have. Step two is to continue to create porous boundaries between this product and the whole rest of the world, whether that's the Teladoc world of virtual primary care, the Livongo world of remote monitoring. We want to make sure that we are supporting the mental health needs of people with chronic medical conditions, which are more significant in general than the general population. And we want to create porous boundaries with the healthcare system at large, because it absolutely does not make sense to be a shadow healthcare system. We understand that we play a part in people's lives and that we need to fit into that life in every way that we can in order to see those people as whole people and get them the care that they need.
I love that. I love digging into this Livongo Teladoc integration. Like bit by bit, it's all becoming clear. I love it. Congratulations on this work, Julia. I mean, it's exciting to hear how far this has come and to really see like that part of the integration of what was already there at Livongo. Like the tech side gets stronger, those applied health signals get stronger, and then also leveraging fully that virtual care side of what Teladoc Health has already spent years building. So thank you so much for dropping by and letting us know what's going on. We look forward to the release of MyStrength Complete coming in July, and then you'll have to come back and give us an update and let us know how it's going. Dr. Julia Hoffman, everybody, she is the head of mental health strategy over there at Teladoc Health. I'm Jessica DeMassa, and you've been watching What's the Future Health? So please check out more interviews with those who are changing the way that we do healthcare over on my YouTube channel. That is youtube.com/WTF Health. Dr. Hoffman, pleasure to see you again.
Thank you.
All
see you in a year or less.
Soon.
Thank you.